Question 1. A nurse is preparing to administer medications to a client. Which actions demonstrate adherence to medication safety principles? Select all that apply. A. Administering a medication dispensed from a different client's bin to save time. B. Checking the client's identification band against the medication administration record, MAR. C. Questioning an order if the dose seems unusually high or low for the client's condition. D. Documenting medication administration immediately after the drug is given. E. Having another nurse verify high-alert medication calculations. F. Crushing all extended-release tablets to facilitate easier swallowing. Answer. Checking the client's identification band against the medication administration record, MAR, questioning an order if the dose seems unusually high or low for the client's condition, documenting medication administration immediately after the drug is given, having another nurse verify high-alert medication calculations. This question tests the nurse's understanding of the rights of medication administration, which are crucial for patient safety. Key actions like verifying client identity, questioning questionable orders, documenting promptly, and seeking independent double-checks for high-alert medications, such as insulin or heparin, are essential to prevent errors. For instance, if a nurse questions a dose that seems off, it could prevent an overdose or underdose, ensuring the client receives appropriate care. Always prioritize patient safety by following established medication protocols and questioning anything that doesn't seem right. Question 2. The nurse is caring for a client with a new colostomy. Which findings indicate the client is adjusting well to their new ostomy? Select all that apply. A. Client refuses to look at the stoma or participate in care. B. Client verbalizes understanding of dietary modifications. C. Stoma is beefy red and moist with some edema. D. Client independently empties and changes the ostomy pouch. E. Client expresses concerns about body image changes. F. Client asks questions about returning to previous activities, such as swimming. Answer. Client verbalizes understanding of dietary modifications. Stoma is beefy red and moist with some edema. Client independently empties and changes the ostomy pouch. Client asks questions about returning to previous activities, such as swimming. This question assesses the nurse's ability to identify positive adaptation to a new colostomy, focusing on physical assessment, education, and psychological adjustment. A healthy stoma is beefy red and moist, indicating good blood supply, and some initial edema is normal. Understanding diet, participating in self-care, and inquiring about resuming normal life activities all suggest healthy coping and readiness for discharge. For example, a client independently changing their pouch demonstrates newfound confidence and skill. Encourage clients to take an active role in their care and ask questions to promote autonomy and positive adjustment. Question 3. A client is admitted with suspected acute appendicitis. Which assessment findings should the nurse expect? Select all that apply. A. Rebound tenderness at McBurney's point. B. Right upper quadrant pain radiating to the shoulder. C. Increased appetite and recent weight gain. D. Elevated white blood cell count, leukocytosis. E. Low-grade fever. F. Diarrhea with bloody stools. Answer. Rebound tenderness at McBurney's point, elevated white blood cell count, leukocytosis, low-grade fever. This question evaluates the nurse's knowledge of the classic signs and symptoms of acute appendicitis. Appendicitis typically presents with periumbilical pain that migrates to the right lower quadrant, often accompanied by rebound tenderness. pain upon release of pressure, at McBurney's point, a low-grade fever, and an elevated white blood cell count, leukocytosis, indicating inflammation or infection. For instance, a client complaining of sharp pain in the lower right abdomen that intensifies when the nurse quickly removes their hand after palpation should raise suspicion for appendicitis. Remember that key indicators are localized pain, inflammation markers, and fever. Question 4. The nurse is providing discharge teaching to a client diagnosed with heart failure. Which instructions are important to include? Select all that apply. A. Report a weight gain of 2 to 3 pounds in 1 day or 5 pounds in a week. B. Restrict fluid intake as prescribed by the healthcare provider. C. Engage in strenuous exercise daily to strengthen the heart. D. Monitor and record daily weights. E. Limit sodium intake to less than 1,500 milligrams per day. F. Take diuretics only when experiencing shortness of breath. Answer. Report a weight gain of 2 to 3 pounds in 1 day or 5 pounds in a week. Restrict fluid intake as prescribed by the healthcare provider. Monitor and record daily weights. Limit sodium intake to less than 1,500 milligrams per day. This question focuses on essential discharge teaching for a client with heart failure, emphasizing fluid and sodium management and symptom monitoring. Clients with heart failure are prone to fluid overload, so monitoring daily weight helps detect fluid retention early, and reporting significant weight gain, restricting fluids, and limiting sodium are crucial interventions. For example, consistently weighing oneself each morning before breakfast can help a client track fluid status changes and intervene before severe symptoms develop. Educating clients on self-monitoring and adherence to dietary restrictions can significantly reduce hospital readmissions. Question 5. The nurse is caring for a client receiving continuous enteral feedings via a nasogastric tube. Which actions are appropriate for the nurse to perform? Select all that apply. A. Elevate the head of the bed to at least 30 to 45 degrees. B. Check gastric residual volume every 4 to 6 hours. C. Administer medications by mixing them directly into the feeding formula. D. Flush the tube with 15 to 30 milliliters of water before and after medication administration. E. Change the feeding bag and tubing every 24 hours. F. Palpate the abdomen for distension and tenderness. Answer. Elevate the head of the bed to at least 30 to 45 degrees. Check gastric residual volume every 4 to 6 hours. Flush the tube with 15 to 30 milliliters of water before and after medication administration. Change the feeding bag and tubing every 24 hours. Palpate the abdomen for distension and tenderness. This question assesses knowledge of safe and effective care for clients with continuous enteral feedings. Elevating the head of the bed prevents aspiration, checking gastric residual volumes helps prevent overfeeding and vomiting, and flushing the tube maintains patency and proper drug delivery. Regular changing of feeding equipment prevents bacterial growth, and abdominal assessment identifies complications like distension. For example, maintaining the head of the bed elevated during and after feeding directly reduces the risk of stomach contents entering the lungs. Remember to always prioritize client safety and comfort during enteral nutrition. Question 6. A client is experiencing an acute asthma exacerbation. Which assessment findings would the nurse expect? Select all that apply. A. Inspiratory wheezing. B. Bradycardia. C. Prolonged expiratory phase. D. Use of accessory muscles for breathing. E. Pink, frothy sputum. F. Shortness of breath, dyspnea. Answer: inspiratory wheezing, prolonged expiratory phase, use of accessory muscles for breathing, shortness of breath, dyspnea. This question tests the nurse's understanding of the clinical manifestations of an acute asthma attack. During an exacerbation, the airways constrict, leading to characteristic signs such as wheezing, often inspiratory and expiratory, but commonly pronounced on inspiration, a prolonged expiratory phase due to air trapping, difficulty breathing, dyspnea, and the use of accessory muscles as the client struggles to move air. For instance, observing a client using their neck and shoulder muscles to breathe indicates significant respiratory distress. Recognizing these signs helps nurses intervene promptly to relieve airway constriction. Question 7. The nurse is reinforcing teaching with a client about preventing deep vein thrombosis, DVT, after surgery. Which instructions should the nurse include? Select all that apply. A. Keep legs elevated while sitting in a chair. B. Perform ankle pumps and calf stretches regularly. C. Ambulate frequently as tolerated. D. Maintain adequate hydration. E. Avoid wearing compression stockings at night. F. Cross legs at the ankles when sitting. Answer: perform ankle pumps and calf stretches regularly, ambulate frequently as tolerated, maintain adequate hydration. This question focuses on preventative measures for deep vein thrombosis, DVT, in postoperative clients. Key strategies include promoting circulation through movement, such as ankle pumps and regular ambulation, and maintaining hydration to prevent blood thickening. For example, a client walking several times a day around their room actively reduces venous stasis. Teach clients that movement and hydration are crucial allies in preventing blood clot formation. Question 8. The nurse is caring for a client with a full-thickness wound. Which actions should the nurse take during wound care? Select all that apply. A. Cleanse the wound with vigorous scrubbing. B. Wear sterile gloves for direct wound contact. C. Assess the wound for signs of infection such as redness, warmth, or purulent drainage. D. Obtain a wound culture if foul odor or increased pain is noted. E. Apply a dry, sterile dressing to a wound with heavy exudate. F. Measure the wound dimensions at each dressing change. Answer: wear sterile gloves for direct wound contact, assess the wound for signs of infection such as redness, warmth, or purulent drainage, obtain a wound culture if foul odor or increased pain is noted, measure the wound dimensions at each dressing change. This question assesses principles of appropriate wound care for a full-thickness wound. Wearing sterile gloves for direct contact with the wound protects against infection, while thorough assessment for infection signs and measuring wound dimensions are critical for monitoring healing progress and identifying complications. Obtaining a wound culture when infection is suspected helps guide treatment. For instance, observing new redness around the wound edge, along with foul-smelling discharge, would prompt the nurse to consider obtaining a culture. Always remember to maintain asepsis and meticulously assess the wound during each dressing change. Question 9. A nurse is preparing to administer an intravenous, 4, push medication. Which steps should the nurse take? Select all that apply. A. Inject the medication rapidly to ensure quick absorption. B. Check for blood return and patency of the 4 site before administration. C. Dilute all 4 push medications with 10 milliliters of normal saline. D. Administer the medication at the recommended rate. E. Flush the 4 line with normal saline before and after medication administration. F. Delegate 4 push medication administration to a licensed practical nurse, LPN. Answer. Check for blood return and patency of the site before administration, administer the medication at the recommended rate, flush the line with normal saline before and after medication administration. This question tests the safe administration of intravenous push medications. Key steps include verifying site patency by checking for blood return and flushing, administering the medication at the correct, often slow, rate to prevent adverse effects, and flushing again to ensure all medication enters the bloodstream and to prevent incompatibility with other fluids. For example, if a client's site shows no blood return and swelling is present, the nurse must establish a new site before administering the medication. Always prioritize patient safety by following precise medication administration protocols and verifying access. Question 10. The nurse is providing education to a client prescribed warfarin. Which statements indicate that the client understands the teaching? Select all that apply. A. I will avoid eating green leafy vegetables. B. I should report any unusual bleeding or bruising to my doctor. C. I will take aspirin or ibuprofen for pain relief. D. I need to have regular blood tests, like INR, to check my medication level. E. I can stop taking this medication when I feel better. F. I will use an electric razor for shaving instead of a straight razor. Answer. I should report any unusual bleeding or bruising to my doctor. I need to have regular blood tests, like INR, to check my medication level. I will use an electric razor for shaving instead of a straight razor. This question assesses the client's understanding of essential safety precautions and monitoring for warfarin, an anticoagulant. Clients on warfarin must be aware of bleeding risks, requiring them to report signs of bleeding and use soft toothbrushes and electric razors to minimize trauma. Regular INR, International Normalized Ratio, monitoring is vital to ensure the medication's effectiveness and safety, and consistent intake of vitamin K-rich foods, like green leafy vegetables, is encouraged, not avoided, to maintain stable INR levels. For instance, a client who switches to an electric razor demonstrates an understanding of minimizing injury risks. Emphasize the importance of adherence, monitoring, and immediately reporting adverse effects. Question 11. A client with a urinary catheter reports discomfort and a feeling of needing to urinate. Which actions should the nurse take first? Select all that apply. A. Encourage increased fluid intake. B. Check the catheter for kinks or obstructions. C. Assess the client's vital signs. D. Palpate the bladder for distension. E. Administer a prescribed analgesic. F. Remove the catheter immediately. Answer. Check the catheter for kinks or obstructions, palpate the bladder for distension, assess the client's vital signs. This question prioritizes nursing actions for a client with a urinary catheter experiencing discomfort. The immediate priority is to assess for mechanical issues or potential complications. Checking for kinks or obstructions in the tubing ensures proper drainage, and palpating the bladder helps determine if bladder distension, a full bladder despite the catheter, is causing the discomfort. Assessing vital signs can rule out systemic issues like infection. For example, if the catheter tubing is kinked, simply straightening it can relieve the discomfort. Always troubleshoot the most likely, easily correctable causes before assuming a more complex problem. Question 12. The nurse is caring for a client with a new diagnosis of type 2 diabetes mellitus. Which information should the nurse include in the teaching plan? Select all that apply. A. Importance of regular blood glucose monitoring. B. Instructions on how to administer insulin injections. C. Recognition of signs and symptoms of hypoglycemia. D. Importance of regular exercise and physical activity. E. Dietary modifications, including carbohydrate counting. F. Annual dilated eye exams. Answer. Importance of regular blood glucose monitoring, recognition of signs and symptoms of hypoglycemia, importance of regular exercise and physical activity, dietary modifications, including carbohydrate counting, annual dilated eye exams. This question focuses on comprehensive education for a client newly diagnosed with type 2 diabetes. Key teaching areas include self-monitoring blood glucose, understanding and managing hypoglycemia, promoting a healthy lifestyle through diet and exercise, and recognizing the importance of regular health screenings, such as annual dilated eye exams to detect complications. For instance, explaining carbohydrate counting helps clients make informed dietary choices to manage blood sugar levels effectively. Emphasize that consistent self-management and regular checkups are vital for preventing long-term complications. Question 13. A client is receiving oxygen therapy via nasal cannula. Which observations indicate effective and safe use of the oxygen? Select all that apply. A. Client's oxygen saturation, SpO2, is 96%. B. Nasal mucosa appears dry and cracked. C. Oxygen flow meter is set to 8 liters per minute. D. Client denies shortness of breath. E. Tubing is free of kinks. F. Humidifier is bubbling appropriately. Answer. Client's oxygen saturation, SpO2, is 96%. Client denies shortness of breath. Tubing is free of kinks. Humidifier is bubbling appropriately. This question evaluates the nurse's ability to assess for effective and safe oxygen therapy via nasal cannula. A stable oxygen saturation, SpO2, of 96% and the absence of shortness of breath indicate therapeutic effectiveness. Safe use includes ensuring the tubing is free of kinks to allow uninterrupted flow and that the humidifier is functioning correctly to prevent nasal dryness, especially at higher flow rates, typically above 4 liters per minute for humidification. For example, seeing the humidifier bubble gently confirms it's adding moisture to the oxygen, which is good for the client's nasal passages. Always verify proper equipment function and desired therapeutic effects. Question 14. The nurse is caring for a client who underwent a total hip arthroplasty. Which precautions should the nurse reinforce to prevent hip dislocation? Select all that apply. A. Avoid flexing the hip more than 90 degrees. B. Place a pillow between the client's legs when turning. C. Encourage internal rotation of the affected hip. D. Avoid crossing the legs or ankles. E. Instruct the client to sit in low chairs or recliners. F. Ensure the client uses an elevated toilet seat. Answer. Avoid flexing the hip more than 90 degrees. Place a pillow between the client's legs when turning. Avoid crossing the legs or ankles. Ensure the client uses an elevated toilet seat. This question addresses critical postoperative precautions to prevent hip dislocation after a total hip arthroplasty. The hip joint is most vulnerable to dislocation with extreme flexion, beyond 90 degrees, adduction, crossing legs, and internal rotation. Using an abductor pillow between the legs, avoiding crossing legs, and using elevated seating, like an elevated toilet seat, helps maintain proper alignment. For example, using a grabber tool to pick up items from the floor instead of bending down prevents excessive hip flexion. Teach clients that maintaining specific body alignment is crucial for protecting the new hip joint during the healing process. Question 15. The nurse is assessing a client for pain. Which objective indicators might suggest the client is experiencing pain? Select all that apply. A. Client reports pain level of 7/10. B. Grimacing or guarding a body part. C. Increased heart rate and blood pressure. D. Rapid, shallow breathing. E. Client states, "I'm not hurting right now." E. Restlessness or agitation. Answer. Grimacing or guarding a body part, increased heart rate and blood pressure, rapid, shallow breathing, restlessness or agitation. This question focuses on recognizing objective, observable signs that may indicate a client is experiencing pain, especially when verbal communication is limited or unreliable. Objective signs include nonverbal expressions like grimacing, guarding a painful area, physiological changes such as increased heart rate and blood pressure, altered breathing patterns, e.g., rapid, shallow, and behavioral changes like restlessness or agitation. For example, observing a client clenching their jaw and tensing their abdominal muscles, even if they deny pain, suggests discomfort. Always combine subjective reports with objective observations to get a complete picture of a client's pain experience. Question 16. The nurse is caring for an older adult client at risk for falls. Which interventions should the nurse implement? Select all that apply. A. Keep the bed in the lowest position. B. Ensure adequate lighting in the client's room. C. Place all necessary items within the client's reach. D. Apply wrist restraints to prevent the client from getting out of bed. E. Encourage the client to wear non-skid footwear. E. Keep all 4 side rails up at all times. Answer. Keep the bed in the lowest position, ensure adequate lighting in the client's room, place all necessary items within the client's reach, encourage the client to wear non-skid footwear. This question addresses fall prevention strategies specifically for older adult clients. Essential interventions include lowering the bed to reduce the distance of a potential fall, ensuring good lighting to improve visibility, placing call lights and personal items within easy reach to prevent the need for clients to stretch or get up unassisted, and promoting the use of non-skid footwear for better traction. For example, ensuring the call light is clipped to the client's gown empowers them to ask for help rather than attempting to reach for things on their own. Focus on creating a safe environment and empowering clients while maintaining their dignity and independence. Question 17. A nurse is preparing to insert a peripheral intravenous, 4, catheter. Which actions indicate appropriate technique? Select all that apply. A. Apply a tourniquet 6 to 8 inches above the chosen insertion site. B. Select the largest vein possible for insertion to ensure patency. C. Cleanse the insertion site with an antiseptic solution using a back-and-forth scrubbing motion. D. Stabilize the vein below the insertion site by pulling the skin taut. E. Insert the catheter with the bevel facing downwards. E. Release the tourniquet after successful venipuncture and before advancing the catheter fully. Answer. Apply a tourniquet 6 to 8 inches above the chosen insertion site. Cleanse the insertion site with an antiseptic solution using a back-and-forth scrubbing motion. Stabilize the vein below the insertion site by pulling the skin taut. Release the tourniquet after successful venipuncture and before advancing the catheter fully. This question focuses on the correct technique for inserting a peripheral 4 catheter, emphasizing infection control and successful venipuncture. Proper tourniquet placement, thorough antiseptic cleansing, often with a back-and-forth motion depending on the agent, stabilizing the vein, and releasing the tourniquet once blood return is achieved and before advancing the entire catheter are crucial steps. For example, applying traction to the skin below the site prevents the vein from rolling, making insertion easier and more successful. Always prioritize proper preparation and sterile technique to ensure client safety and successful fore access. Question 18. The nurse is caring for a client with hyperkalemia. Which assessment findings would the nurse expect to observe? Select all that apply. A. Peak T waves on ECG. B. Muscle weakness or flaccid paralysis. C. Diarrhea. D. Hypotension. E. Hypoactive bowel sounds. F. Nausea and vomiting. Answer. Peak T waves on ECG, muscle weakness or flaccid paralysis, diarrhea, nausea and vomiting. This question assesses knowledge of the clinical manifestations of hyperkalemia, high potassium levels. Hyperkalemia can significantly affect cardiac function, leading to characteristic ECG changes like peak T waves, and can cause neuromuscular symptoms such as muscle weakness and even paralysis. Gastrointestinal symptoms like nausea, vomiting, and diarrhea are also common. For instance, a client with an elevated potassium level who suddenly develops muscle weakness should be monitored closely for cardiac changes. Always remember that hyperkalemia is a serious electrolyte imbalance that requires prompt intervention due to its potential impact on the heart. Question 19. A nurse is preparing to administer a subcutaneous injection. Which sites are appropriate for this type of injection? Select all that apply. A. Deltoid muscle. B. Outer posterior aspect of the upper arm. C. Abdomen, at least 2 inches from the umbilicus. D. Ventrogluteal area. E. Anterior aspects of the thighs. F. Dorsogluteal area. Answer. Outer posterior aspect of the upper arm, abdomen, at least 2 inches from the umbilicus, anterior aspects of the thighs. This question tests the nurse's knowledge of appropriate anatomical sites for subcutaneous injections, which involve injecting medication into the fatty tissue just below the skin. Recommended sites are those with adequate subcutaneous tissue and fewer major blood vessels or nerves, such as the outer posterior aspect of the upper arm, the abdomen, avoiding the navel area, and the anterior thighs. For example, insulin is commonly administered in the abdomen because it provides a good area for absorption and is easy for clients to access for self-administration. Always rotate injection sites to prevent tissue damage and promote consistent absorption. Question 20. The nurse is teaching a client about self-management of mild anxiety. Which non-pharmacological interventions should the nurse suggest? Select all that apply. A. Practice deep breathing exercises. B. Engage in regular physical activity. C. Limit caffeine and alcohol intake. D. Seek out stressful situations to build resilience. E. Get adequate sleep. F. Engage in hobbies or relaxing activities. Answer. Practice deep breathing exercises, engage in regular physical activity, limit caffeine and alcohol intake, get adequate sleep, engage in hobbies or relaxing activities. This question addresses non-pharmacological strategies for managing mild anxiety, focusing on lifestyle modifications and relaxation techniques. Deep breathing, regular exercise, reducing stimulants like caffeine and alcohol, ensuring sufficient sleep, and engaging in enjoyable hobbies all contribute to stress reduction and overall well-being. For instance, taking a 15-minute walk daily can significantly reduce feelings of anxiety by releasing endorphins. Encourage clients to incorporate a combination of these strategies into their daily routine to promote relaxation and cope with stress effectively. Question 21. A client is experiencing an allergic reaction to a new medication. Which assessment findings indicate an allergic reaction? Select all that apply. A. Urticaria, hives. B. Bradycardia. C. Angioedema, swelling, especially of the face or throat. D. Wheezing and difficulty breathing. E. Sudden drop in blood pressure. F. Pinpoint pupils. Answer. Urticaria, hives, angioedema, swelling, especially of the face or throat, wheezing and difficulty breathing, sudden drop in blood pressure. This question assesses the nurse's ability to recognize the signs and symptoms of an allergic reaction, which can range from mild to severe, anaphylaxis. Common manifestations include skin reactions like hives, urticaria, swelling of the face or throat, angioedema, respiratory distress such as wheezing and difficulty breathing, and cardiovascular changes like a sudden drop in blood pressure. For example, if a client develops hives and swelling around their lips shortly after receiving a new antibiotic, it strongly suggests an allergic response. Prompt recognition and intervention are crucial to prevent progression to a life-threatening anaphylactic reaction. Question 22. The nurse is caring for a client with chronic obstructive pulmonary disease, COPD. Which actions are appropriate to include in the client's plan of care? Select all that apply. A. Encourage daily use of incentive spirometer. B. Instruct on pursed lip breathing techniques. C. Encourage a high-calorie, high-protein diet. D. Limit fluid intake to prevent fluid overload. E. Administer oxygen at a high flow rate, e.g., 6 liters per minute. F. Assist with positioning for optimal lung expansion. Answer. Instruct on pursed lip breathing techniques, encourage a high-calorie, high-protein diet, assist with positioning for optimal lung expansion. This question focuses on appropriate nursing interventions for clients with chronic obstructive pulmonary disease, COPD. Pursed lip breathing helps prolong exhalation and prevent air trapping, while a high-calorie, high-protein diet supports energy needs and prevents muscle wasting. Positioning clients upright or in a high Fowler's position promotes optimal lung expansion and diaphragmatic excursion. For instance, teaching a client to breathe out slowly through pursed lips helps them expel trapped air and reduces shortness of breath. Remember that for COPD clients, oxygen administration needs careful titration to avoid suppressing their hypoxic drive, and incentive spirometry is typically used for inspiration, not the prolonged expiration crucial for COPD. Question 23. A nurse is teaching a client about managing constipation. Which recommendations should the nurse provide? Select all that apply. A. Increase dietary fiber intake. B. Limit daily fluid consumption. C. Engage in regular physical activity. D. Ignore the urge to defecate until a more convenient time. E. Establish a regular bowel routine. F. Use laxatives daily as a preventative measure. Answer. Increase dietary fiber intake, engage in regular physical activity, establish a regular bowel routine. This question assesses knowledge of non-pharmacological strategies for managing and preventing constipation. Key recommendations include increasing fiber intake, e.g., fruits, vegetables, whole grains, engaging in regular physical activity to stimulate bowel motility, and establishing a consistent bowel routine. For example, encouraging a client to drink at least 8 glasses of water daily and go for a short walk after meals can significantly improve bowel regularity. Emphasize that these lifestyle changes are foundational for long-term bowel health. Question 24. The nurse is preparing a sterile field for a dressing change. Which actions maintain sterility? Select all that apply. A. Place sterile items within 1 inch of the field's edge. B. Hold sterile items above the waist level. C. Turn your back to the sterile field to retrieve supplies. D. Keep sterile gloved hands above waist level. E. Avoid talking, coughing, or sneezing over the sterile field. F. Pour solutions onto the sterile field from more than 12 inches away. Answer. Hold sterile items above the waist level, keep sterile gloved hands above waist level, avoid talking, coughing, or sneezing over the sterile field. This question tests the nurse's understanding of principles for maintaining a sterile field. Key rules include keeping all sterile items and gloved hands above waist level, as anything below the waist is considered contaminated, and avoiding activities like talking or coughing over the field to prevent droplet contamination. For example, if a sterile drape touches your scrubs below the waist, it is no longer considered sterile. Remember to always face the sterile field and consider any edge or anything below the waist as contaminated. Question 25. A nurse is assessing a client for fluid volume deficit, dehydration. Which findings would support this diagnosis? Select all that apply. A. Bounding peripheral pulses. B. Dry mucous membranes. C. Decreased skin turgor. D. Increased urine output. E. Tachycardia. F. Hypotension. Answer. Dry mucous membranes, decreased skin turgor, tachycardia, hypotension. This question assesses the nurse's ability to identify clinical indicators of fluid volume deficit, dehydration. Key signs of dehydration include dry mucous membranes, poor skin turgor, skin that stays tented after being pinched, increased heart rate, tachycardia, as the heart compensates for reduced blood volume, and a drop in blood pressure, hypotension. For example, a client with cracked lips and whose skin on the forearm remains tented for a few seconds after being pinched demonstrates signs of dehydration. Recognizing these physical signs is crucial for prompt intervention to restore fluid balance. Question 26. The nurse is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. Which actions are appropriate? Select all that apply. A. Connect the NG tube to continuous suction without a healthcare provider's order. B. Elevate the head of the bed to at least 30 degrees. C. Measure the length of the exposed NG tube and check placement every shift. D. Irrigate the NG tube with 30 milliliters of normal saline every 4 hours or as needed. E. Offer ice chips and sips of water to keep the client hydrated. F. Auscultate bowel sounds regularly. Answer. Elevate the head of the bed to at least 30 degrees, measure the length of the exposed NG tube and check placement every shift. Irrigate the NG tube with 30 milliliters of normal saline every 4 hours or as needed. Auscultate bowel sounds regularly. This question tests appropriate care for a client with an NG tube for gastric decompression. Key actions include elevating the head of the bed to prevent aspiration, regularly checking NG tube placement, e.g., by measuring the external length and pH, testing aspirate, and patency, irrigating the tube as ordered to prevent clogs, and assessing bowel sounds to monitor gastrointestinal function. For instance, before administering medications or flushing, Always confirm tube placement by checking gastric pH or using other agency protocols. Prioritize maintaining tube patency and preventing complications like aspiration. Question 27. The nurse is assisting a client with ambulation after a period of prolonged bed rest. Which actions are essential for client safety? Select all that apply. A. Have the client dangle their legs at the bedside before standing. B. Instruct the client to push off from the bed with their arms. C. Ensure the client is wearing non-skid footwear. D. Use a gait belt around the client's waist. E. Walk slightly behind and to the side of the client. F. Encourage the client to hold onto the nurse's arm for support. Answer. Have the client dangle their legs at the bedside before standing. Ensure the client is wearing non-skid footwear. Use a gait belt around the client's waist. Walk slightly behind and to the side of the client. This question emphasizes safety during client ambulation, especially after inactivity. Dangling legs at the bedside helps prevent orthostatic hypotension, non-skid footwear prevents slipping, and a gait belt provides a secure grip for the nurse to assist or support if the client loses balance. Walking slightly behind and to the side allows the nurse to maintain control and react quickly to any instability. For example, if a client experiences dizziness when standing, having them dangle their legs first allows their blood pressure to stabilize, reducing fall risk. Always prioritize client safety by preparing adequately and providing appropriate support. Question 28. A client has a new prescription for a transdermal patch. Which instructions should the nurse provide? Select all that apply. A. Apply the patch to hairy skin for better adhesion. B. Rotate application sites with each new patch. C. Cleanse the skin with soap and water and dry thoroughly before application. D. Leave the old patch on when applying a new one. E. Press firmly on the patch for about 10 seconds to ensure adherence. F. Discard used patches in the regular trash can. Answer. Rotate application sites with each new patch. Cleanse the skin with soap and water and dry thoroughly before application. Press firmly on the patch for about 10 seconds to ensure adherence. This question assesses the nurse's knowledge of proper transdermal patch application for optimal medication delivery and skin integrity. Key instructions include rotating sites to prevent skin irritation, cleansing the skin to remove oils that could interfere with adhesion, and pressing firmly to ensure complete skin contact. For instance, applying a patch to the same spot repeatedly can lead to localized skin reactions or altered drug absorption. Always follow manufacturer guidelines for specific patches, and emphasize meticulous skin preparation and site rotation. Question 29. The nurse is caring for a client experiencing dyspnea, difficulty breathing. Which nursing interventions can help alleviate the client's discomfort? Select all that apply. A. Place the client in a supine position. B. Administer oxygen as prescribed. C. Encourage slow, deep breathing exercises. D. Encourage frequent repositioning. E. Provide emotional support and reassurance. F. Restrict fluid intake. Answer. Administer oxygen as prescribed, encourage slow, deep breathing exercises, encourage frequent repositioning, provide emotional support and reassurance. This question focuses on nursing interventions to relieve dyspnea. Administering prescribed oxygen improves oxygenation, while encouraging slow, deep breathing helps optimize respiratory effort. Frequent repositioning can promote lung expansion and comfort, and providing emotional support reduces anxiety, which can worsen dyspnea. For example, Helping a client sit upright and providing a fan for air movement can make breathing feel easier. Always address both the physical and emotional aspects of dyspnea to provide holistic care. Question 30. A nurse is providing care for a client with Clostridium difficile, C. difficile, infection. Which infection control measures are essential? Select all that apply. A. Use alcohol-based hand sanitizer before and after client contact. B. Wear gloves and a gown when entering the client's room. C. Use bleach-containing cleaning products for environmental surfaces. D. Place the client in a private room. E. Restrict the client's visitors. F. Wash hands thoroughly with soap and water. Answer. Wear gloves and a gown when entering the client's room. Use bleach-containing cleaning products for environmental surfaces. Place the client in a private room. Wash hands thoroughly with soap and water. This question addresses crucial infection control measures for Clostridium difficile, C. difficile, a highly transmissible pathogen. C. diff requires contact precautions, including wearing gloves and a gown, and placing the client in a private room to prevent spread. Crucially, alcohol-based hand sanitizers are ineffective against C. diff spores, necessitating thorough hand washing with soap and water. Bleach-containing disinfectants are required for environmental cleaning. For example, a nurse meticulously washing their hands with soap and water for at least 20 seconds after leaving a C. diff client's room is a vital step in breaking the chain of infection. Always remember the specific precautions required for spore-forming bacteria like C. diff. Question 31. The nurse is assessing a client for potential elder abuse. Which observations might indicate elder abuse? Select all that apply. A. Frequent arguments between the client and caregiver. B. Unexplained bruises, welts, or fractures. C. Client appears disheveled, malnourished, or dehydrated. D. Caregiver's reluctance to leave the client alone with healthcare providers. E. Client frequently voices feelings of loneliness and isolation. F. Sudden changes in the client's financial situation. Answer. Unexplained bruises, welts, or fractures, client appears disheveled, malnourished, or dehydrated, caregiver's reluctance to leave the client alone with healthcare providers, sudden changes in the client's financial situation. This question tests the nurse's ability to identify potential indicators of elder abuse, which encompasses physical, neglect, emotional, and financial forms. Suspicious signs include unexplained injuries, bruises, welts, fractures, signs of neglect, disheveled appearance, malnutrition, dehydration, a caregiver's controlling behavior, reluctance to leave the client alone, and sudden, unexplained financial changes. For example, a client with multiple unexplained bruises at different stages of healing, whose caregiver insists on answering all questions, raises serious concerns. Nurses have a legal and ethical responsibility to report suspected elder abuse. Question 32. A client is prescribed a clear liquid diet. Which food and beverage items are appropriate for this diet? Select all that apply. A. Cream of mushroom soup. B. Gelatin, Jell-O. C. Apple juice. D. Plain yogurt. E. Chicken broth. F. Popsicles. Answer. Gelatin, Jell-O, apple juice, chicken broth, popsicles. This question assesses knowledge of foods and beverages appropriate for a clear liquid diet, which consists of transparent liquids that are liquid at body temperature and leave minimal residue in the GI tract. Acceptable items include broth, clear juices without pulp, like apple or cranberry, gelatin, popsicles, and carbonated beverages. For example, offering a client red gelatin helps provide some calories and hydration while adhering to the clear liquid restrictions. Remember that foods like cream soups or yogurt would be considered full liquids. Question 33. The nurse is documenting care in a client's electronic health record, EHR. Which actions demonstrate appropriate documentation practices? Select all that apply. A. Documenting care immediately after it is provided. B. Using general terms like client doing well instead of specific observations. C. Including objective data only, excluding client's subjective statements. D. Documenting any client refusal of treatment. E. Correcting an error by drawing a single line through it and initialing. F. Documenting all communication with other healthcare providers. Answer. Documenting care immediately after it is provided, documenting any client refusal of treatment, documenting all communication with other healthcare providers. This question focuses on best practices for accurate and legal documentation in the electronic health record. Key principles include timely documentation to ensure accuracy, clearly recording any refusal of treatment by the client, and documenting all communications with other providers to ensure a comprehensive record of care. For example, if a client refuses their morning medication, documenting this refusal, along with the education provided and the client's stated reason, is crucial. Remember that documentation should be factual, objective, and reflect all aspects of client care and communication. Question 34. The nurse is administering a blood transfusion to a client. Which actions are essential before initiating the transfusion? Select all that apply. A. Obtain the client's written consent for the transfusion. B. Verify the blood product with another licensed nurse. C. Initiate the transfusion within 60 minutes of receiving the blood from the blood bank. D. Infuse the blood product rapidly over 30 minutes. E. Assess the client's baseline vital signs. F. Prime the blood tubing with dextrose 5% in water. Answer. Obtain the client's written consent for the transfusion, verify the blood product with another licensed nurse, initiate the transfusion within 60 minutes of receiving the blood from the blood bank, assess the client's baseline vital signs. This question emphasizes critical safety measures before initiating a blood transfusion. Obtaining informed consent ensures the client understands the procedure and risks. Verifying the blood product with a second licensed nurse, two-person check, against the client's identification is paramount to prevent ABO incompatibility. Blood products must be started promptly, within 30 to 60 minutes, to prevent bacterial growth, and baseline vital signs are essential for monitoring for transfusion reactions. For example, a nurse and another registered nurse confirming the client's name, blood type, and unit number on the blood bag precisely matches the client's information prevents potentially fatal errors. Always adhere strictly to transfusion protocols to ensure client safety. Question 35. The nurse is teaching a client about proper body mechanics to prevent back injury. Which instructions should the nurse include? Select all that apply. A. Bend at the waist when lifting heavy objects. B. Keep the back straight and bend at the knees. C. Hold objects away from the body when lifting. D. Use leg muscles to lift, not back muscles. E. Ask for help when an object is too heavy to lift alone. F. Twist the body when turning with a heavy object. Answer. Keep the back straight and bend at the knees. Use leg muscles to lift, not back muscles. Ask for help when an object is too heavy to lift alone. This question focuses on teaching proper body mechanics to prevent back injury during lifting or moving. Key principles include bending at the knees and hips while keeping the back straight, using strong leg muscles for lifting, and always seeking assistance for heavy or awkward loads. For example, when lifting a box, squatting down, keeping the box close to the body, and standing up using leg strength minimizes strain on the back. Emphasize that preventing back injury involves strategic body positioning and recognizing when to ask for help. Question 36. A client has a prescription for a clear liquid diet. Which foods should the nurse remove from the meal tray? Select all that apply. A. Cream of wheat. B. Apple juice. C. Coffee with cream. D. Broth. E. Orange juice with pulp. F. Sherbet. Answer. Cream of wheat, coffee with cream, orange juice with pulp, sherbet. This question assesses the nurse's understanding of a clear liquid diet. Foods that are considered full liquids or contain solid particles must be removed. Cream of wheat, cereal, coffee with cream, milk product, orange juice with pulp, solid particles, and sherbet, opaque, contains milk products, are not clear liquids. For instance, if a client on a clear liquid diet has a cup of coffee with creamer on their tray, the nurse should remove it and explain that only black coffee is allowed if caffeinated beverages are permitted. Always ensure all items on the tray adhere strictly to the prescribed diet. Question 37. The nurse is performing a focused cardiovascular assessment. Which findings are considered normal? Select all that apply. A. Presence of S3 heart sound. B. Capillary refill less than 3 seconds. C. Regular heart rate of 70 beats per minute. D. Peripheral pulses strong and equal bilaterally. E. Jugular venous distension, JVD, at 45 degrees. F. Absence of edema in the extremities. Answer. Capillary refill less than 3 seconds, regular heart rate of 70 beats per minute, peripheral pulses strong and equal bilaterally, absence of edema in the extremities. This question tests the nurse's ability to identify normal findings during a cardiovascular assessment. Normal findings include a rapid capillary refill, less than 3 seconds, a regular heart rate within the expected range, typically 60 to 100 beats per minute, strong and equal peripheral pulses, and the absence of peripheral edema. For instance, finding a client's radial pulses to be equally palpable on both arms and a refill time of 2 seconds after blanching a nail bed indicates healthy circulation. Remember that S3 heart sounds, jugular venous distension, and peripheral edema are often abnormal findings that require further investigation. Question 38. The nurse is caring for a client with a tracheostomy. Which actions are appropriate for tracheostomy care? Select all that apply. A. Use clean technique when changing the inner cannula. B. Perform tracheostomy care every 4 hours or as needed. C. Cleanse the stoma with hydrogen peroxide solution. D. Suction the tracheostomy tube routinely to prevent mucus plugs. E. Apply a fresh, sterile tracheostomy dressing after cleaning. F. Keep a spare tracheostomy tube of the same size at the bedside. Answer. Perform tracheostomy care every 4 hours or as needed. Apply a fresh, sterile tracheostomy dressing after cleaning. Keep a spare tracheostomy tube of the same size at the bedside. This question assesses appropriate tracheostomy care, emphasizing infection prevention, patency, and emergency preparedness. Tracheostomy care should be performed regularly, a sterile dressing applied to protect the stoma, and a spare tracheostomy tube of the same size, and a size smaller, kept at the bedside for emergencies. For example, having a spare tracheostomy tube readily available is critical if the client accidentally decannulates, allowing for immediate reinsertion. Always maintain sterile technique for inner cannula changes and remember that suctioning should be done only as needed, not routinely, to prevent mucosal trauma. Question 39. A nurse is caring for a client with a history of seizures. Which interventions should the nurse implement during a seizure event? Select all that apply. A. Restrain the client's extremities to prevent injury. B. Loosen tight clothing around the client's neck. C. Place a padded tongue blade in the client's mouth. D. Turn the client to their side. E. Note the time the seizure began and ended. F. Stay with the client and protect them from injury. Answer. Loosen tight clothing around the client's neck. Turn the client to their side. Note the time the seizure began and ended. Stay with the client and protect them from injury. This question focuses on essential nursing interventions during a seizure to ensure client safety and facilitate accurate documentation. Crucial actions include loosening restrictive clothing to aid breathing, turning the client on their side to prevent aspiration, noting the seizure's duration for documentation, and staying with the client while protecting them from injury by moving objects away. For example, if a client starts having a seizure in bed, immediately turning them to their side prevents them from aspirating any secretions. Remember to prioritize airway, breathing, and protecting the client from immediate harm. Question 40. The nurse is providing discharge teaching for a client with a prescription for new crutches. Which instructions are important for safe crutch use? Select all that apply. A. Bear weight on the axillary, armpit, rests. B. Keep crutch tips 6 inches to the side and 6 inches in front of the feet. C. Use the 3-point gate for non-weight bearing on one leg. D. Always use crutches on stairs. E. Ensure rubber crutch tips are intact. F. Look at your feet when walking to ensure proper placement. Answer. Keep crutch tips 6 inches to the side and 6 inches in front of the feet. Use the 3-point gate for non-weight bearing on one leg. Ensure rubber crutch tips are intact. This question assesses knowledge of safe and effective crutch use. Key instructions include proper crutch placement, 6 inches to the side and 6 inches in front, for a stable base, using the appropriate gate, e.g., 3-point for non-weight bearing, as instructed, and ensuring crutch tips are intact to prevent slipping. For example, a client using a 3-point gate correctly moves both crutches and the affected leg forward together, then swings the unaffected leg forward. Always emphasize that weight should be borne on the hands, not the axilla, to prevent nerve damage. Question 41. A client is receiving total parenteral nutrition, TPN. Which nursing interventions are appropriate for the nurse to perform? Select all that apply. A. Monitor blood glucose levels every 4 to 6 hours. B. Change the TPN bag and tubing every 48 hours. C. Administer 4 piggyback medications through the TPN line. D. Assess the client's weight daily. E. Monitor for signs of infection at the central line insertion site. F. Discontinue TPN abruptly if ordered to convert to oral intake. Answer. Monitor blood glucose levels every 4 to 6 hours. Assess the client's weight daily. Monitor for signs of infection at the central line insertion site. This question focuses on essential nursing care for a client receiving total parenteral nutrition, TPN. Due to the high glucose content, monitoring blood glucose every 4 to 6 hours is crucial, as is daily weight assessment to monitor fluid balance. Meticulous monitoring for signs of infection at the central line insertion site is also vital due to the high risk of central line-associated bloodstream infections. For example, if a client's blood glucose levels begin to rise significantly, the nurse should notify the provider to adjust the insulin or TPN rate. Remember that TPN bags and tubing are typically changed every 24 hours, not 48. TPN lines should be dedicated and not used for other medications, and TPN should be tapered slowly to prevent hypoglycemia. Question 42. The nurse is preparing to administer an intramuscular, IM, injection. Which actions are appropriate? Select all that apply. A. Administer the injection at a 45-degree angle. B. Select an appropriate needle gauge and length based on medication viscosity and client's muscle mass. C. Aspirate for blood return before injecting the medication. D. Use the Z-track method for irritating medications. E. Massage the injection site vigorously after administration. F. Choose the deltoid muscle for volumes greater than 3 milliliters. Answer. Select an appropriate needle gauge and length based on medication viscosity and client's muscle mass. Aspirate for blood return before injecting the medication. Use the Z-track method for irritating medications. This question evaluates the nurse's understanding of safe intramuscular, IM, injection techniques. Appropriate actions include selecting the correct needle size based on the medication and client, aspirating for blood return, though not always required for vaccines, it's a general safety measure, and using the Z-track method to prevent medication leakage and reduce irritation, especially for irritating substances. For example, a nurse selecting a 22-gauge, 1/5-inch needle for a viscous medication in an adult's ventrogluteal muscle demonstrates appropriate judgment. Emphasize that IM injections are given at a 90-degree angle, and the deltoid muscle is typically limited to volumes up to 1 milliliter. Question 43. A client is experiencing an acute hypoglycemic episode. Which signs and symptoms would the nurse expect to observe? Select all that apply. A. Hot, dry skin. B. Shakiness or tremors. C. Confusion or difficulty concentrating. D. Fruity breath odor. E. Diaphoresis, sweating. F. Increased thirst. Answer. Shakiness or tremors, confusion or difficulty concentrating, diaphoresis, sweating. This question tests the nurse's recognition of the classic signs and symptoms of hypoglycemia, low blood sugar. Common manifestations include neurological symptoms like shakiness, tremors, confusion, and difficulty concentrating, as well as autonomic symptoms such as sweating, diaphoresis, and hunger. For example, a client who suddenly becomes disoriented, trembles, and is visibly sweating should be immediately assessed for hypoglycemia. Remember that hot, dry skin, fruity breath, and increased thirst are characteristic of hyperglycemia. Question 44. The nurse is caring for a client with a history of chronic back pain. Which non-pharmacological pain management techniques should the nurse suggest? Select all that apply. A. Heat or cold therapy. B. Deep breathing and relaxation exercises. C. Distraction, such as listening to music or watching TV. D. Progressive muscle relaxation. E. Herbal supplements as the primary treatment. F. Strenuous exercise immediately after pain onset. Answer. Heat or cold therapy, deep breathing and relaxation exercises, distraction, such as listening to music or watching TV, progressive muscle relaxation. This question focuses on non-pharmacological pain management strategies for chronic back pain. Effective techniques include heat or cold applications, deep breathing, relaxation exercises, and distraction, all aimed at reducing discomfort and improving coping. Progressive muscle relaxation, where clients tense and then relax different muscle groups, is also a useful technique. For example, applying a warm pack to the lower back can help relax tense muscles and reduce pain. Encourage clients to integrate these techniques into their daily routine as adjunctive therapies. Question 45. A client requires a sterile urine specimen from an indwelling urinary catheter. Which actions should the nurse take? Select all that apply. A. Obtain the specimen from the drainage bag. B. Clamp the catheter tubing below the port for 15 to 30 minutes. C. Cleanse the access port with an antiseptic wipe. D. Use a sterile syringe to withdraw urine from the access port. E. Send the specimen to the lab immediately or refrigerate it. F. Unclamp the catheter tubing after obtaining the specimen. Answer. Clamp the catheter tubing below the port for 15 to 30 minutes, cleanse the access port with an antiseptic wipe, use a sterile syringe to withdraw urine from the access port, send the specimen to the lab immediately or refrigerate it, unclamp the catheter tubing after obtaining the specimen. This question outlines the correct procedure for obtaining a sterile urine specimen from an indwelling catheter, emphasizing infection control and proper collection. Key steps include clamping the tubing to allow urine to collect, thoroughly cleansing the access port, using a sterile syringe to draw the specimen, promptly sending the specimen to the lab, and remembering to unclamp the tubing afterward. For example, clamping the tubing ensures a fresh, uncontaminated urine sample is available at the access port. Always maintain strict aseptic technique to prevent contamination of the specimen and catheter system. Question 46. The nurse is educating a client about a new prescription for antibiotics. Which statements are important to include in the teaching? Select all that apply. A. Take the entire course of antibiotics, even if symptoms improve. B. Stop taking the antibiotic immediately if you experience any side effects. C. Antibiotics are effective against viral infections. D. Report any signs of allergic reaction, such as rash or difficulty breathing. E. Take the medication at the same time each day for consistent blood levels. F. Avoid dairy products when taking this medication, unless specifically contraindicated. Answer. Take the entire course of antibiotics, even if symptoms improve. Report any signs of allergic reaction, such as rash or difficulty breathing. Take the medication at the same time each day for consistent blood levels. This question focuses on essential client education regarding antibiotic therapy for adherence and safety. It's crucial for clients to complete the entire course of antibiotics to prevent antibiotic resistance, report any allergic reactions promptly, and take the medication at consistent times to maintain therapeutic blood levels. For example, a client who understands that stopping the medication early might cause the infection to return and become harder to treat is more likely to be adherent. Emphasize that antibiotics treat bacterial infections, not viral ones, and dairy restrictions are drug-specific. Question 47. The nurse is caring for a client with impaired physical mobility due to a cerebrovascular accident, CVA. Which interventions promote skin integrity? Select all that apply. A. Reposition the client every 2 hours. B. Keep the client's skin clean and dry. C. Massage reddened areas vigorously. D. Use pressure-reducing devices, E.g., specialty mattresses, cushions. E. Limit protein intake to reduce metabolic demands. F. Encourage active or passive range of motion exercises. Answer. Reposition the client every 2 hours, keep the client's skin clean and dry, use pressure-reducing devices, e.g., specialty mattresses, cushions, encourage active or passive range of motion exercises. This question addresses nursing interventions to promote skin integrity in clients with impaired mobility. Key strategies include frequent repositioning to relieve pressure, maintaining clean and dry skin to prevent moisture-associated skin damage, using pressure-reducing devices to distribute weight, and encouraging range of motion exercises to improve circulation and mobility. For example, regularly turning a client from their back to their side helps prevent pressure sores from developing on the bony prominences. Remember that vigorous massage of reddened areas is contraindicated as it can further damage compromised tissue, and adequate nutrition, including protein, is vital for skin healing. Question 48. The nurse is providing perineal care for an uncircumcised male client. Which steps are appropriate? Select all that apply. A. Retract the foreskin gently. B. Cleanse the tip of the penis in a circular motion, from the meatus outward. C. Use the same washcloth to clean the anal area. D. Replace the foreskin after cleaning. E. Cleanse the shaft of the penis from the tip toward the scrotum. F. Apply petroleum jelly to the glands after cleaning. Answer. Retract the foreskin gently, cleanse the tip of the penis in a circular motion, from the meatus outward, replace the foreskin after cleaning, cleanse the shaft of the penis from the tip toward the scrotum. This question details the correct procedure for perineal care in an uncircumcised male client. Essential steps include gently retracting the foreskin, cleaning the glands, tip of the penis, from the meatus, urinary opening, outwards to prevent introducing bacteria, cleaning the shaft, and crucially, replacing the foreskin after cleaning to prevent paraphymosis, a painful swelling of the glands. For example, if a nurse forgets to replace the foreskin, it can become trapped, leading to serious circulatory compromise. Always ensure meticulous and respectful hygiene practices. Question 49. The nurse is assessing a client for potential peripheral neuropathy. Which findings would support this assessment? Select all that apply. A. Reports of burning or tingling sensations in the extremities. B. Diminished sensation to light touch or pain. C. Visible muscle atrophy in the affected limbs. D. Strong, bounding peripheral pulses. E. Decreased deep tendon reflexes. F. Warm, flushed skin in the feet. Answer. Reports of burning or tingling sensations in the extremities, diminished sensation to light touch or pain, visible muscle atrophy in the affected limbs, decreased deep tendon reflexes. This question assesses the nurse's ability to identify signs and symptoms of peripheral neuropathy, a condition characterized by damage to peripheral nerves. Key findings include subjective reports of burning or tingling, paresthesia, objective evidence of diminished sensation, loss of sensation to touch or pain, visible muscle wasting, atrophy, due to nerve damage, and decreased or absent deep tendon reflexes. For example, a client with diabetes who reports numbness in their feet and whose reflexes are significantly reduced is likely experiencing peripheral neuropathy. Always assess for both sensory and motor deficits when suspecting neuropathy. Question 50. The nurse is providing education to a client on how to use an incentive spirometer. Which instructions should the nurse include? Select all that apply. A. Inhale slowly and deeply through the mouthpiece. B. Exhale forcefully into the mouthpiece. C. Hold your breath for 3 to 5 seconds after inhalation. D. Cough deeply after each set of 10 breaths. E. Use the incentive spirometer once or twice a day. F. Aim to reach the predetermined inspiratory volume target. Answer. Inhale slowly and deeply through the mouthpiece, hold your breath for 3 to 5 seconds after inhalation, cough deeply after each set of 10 breaths, aim to reach the predetermined inspiratory volume target. This question focuses on proper technique for using an incentive spirometer, a device designed to encourage deep breathing and prevent pulmonary complications. Correct use involves inhaling slowly and deeply through the mouthpiece, holding the breath for several seconds to maximize lung expansion, and coughing after a set of breaths to clear secretions. Clients should also aim to reach their individualized inspiratory volume target. For instance, a client who takes slow, deep breaths, holds them, and then coughs effectively demonstrates understanding of using the device to prevent pneumonia. Encourage frequent use, typically 10 times an hour while awake, rather than just once or twice a day.